आमच्या सगळ्यांच्या मनान एक प्रश्न आसता तो म्हणजे मोबायल कितलो वापरप, कसो वापरप, मोबायल न्हिदता आसतना उशा कडेन दवरप काय ना, मोबायल वापरूं काय जे पॉड्स आसतात ते वापरूं, इयरपॉड्स आसतात ते वापरूं.
In association with Manipal Hospital's Dona Paula.
कितें करप आनी कितें करप ना हे खूब जाणांचे प्रश्न आसता आनी आमी इंस्टाग्रामार रील पळोवन आपआपलें डिसिजन घेता. सो आतां तुमकां तें करपाची गरज ना. आमचे बरोबर आसा हो पॉडकास्ट कार्यावळीन डॉक्टर ओमकार चुरी, न्यूरोसर्जन विथ मणिपाल हॉस्पिटल. थँक्यू व्हेरी मच.
Thank you for calling me.
Dr. Churi is from Goa, originally from Goa, but his education was in Mumbai. So let's talk to him in English, also for a larger audience who are non-Goans to understand, because this is a global topic.
Yes.
So just tell us, first, shall I use the phone directly or shall I use earbuds?
No, as such, the frequency at which the phone operates is completely different than what we call as ionizing radiation. Ionizing radiation is something like an X-ray or gamma rays. The phone uses frequency which are closer to our FM things. But anything that is in excess is of course going to cause some problems. Now, whether you should use a mobile, the answer to that is yes, because it is made so that our life becomes easy. But it comes with a significant or number of caveats about what to do, what not to do. Better is of course not to press it against the ear. One of the reasons is it can cause local issues because of overheating and something. One. Second, the wires versus the hands-free. Bluetooth. I would prefer the wires because whatever little amount of radiation or waves are there, they are absent when we are using wires, because energy gets converted into electricity and then again into sound energy. So the wires rather than wireless is of course preferable. Apart from that, how we sit, what are we doing while using the mobile also becomes an important.
We'll come to that. First I want to know that I can use the phone.
Certainly.
But how much time to use the phone is a question.
It is a question. Secondly, who should use it is an even more important question, because any kind of energy will be detrimental to a growing or changing object. So in children, the skull itself is very thin. Second, for the first 2 years, the brain almost develops to around 80-90% for whatever it is of adult size. Until about 6 years, it keeps growing. So of course, for an adult to use a phone as compared to for a child to use a phone, of course, we should keep it away from children as much as possible. For this one reason, as well as multiple reasons that
will be discussed.
Certainly.
So I can use the phone.
Yes.
The time duration.
There is no specific time duration, but as I said, if I like some sweets, the sweets mala rasgullaचं कोणी packet दिलं, I don't want to finish the whole packet at once. That is the cause of now ever increasing other medical and other issues. Same happens with the mobile. See, a mobile is for our benefit to not take over our life. So it should be used judiciously to the point that it is essential. Is there a time limit? Every person will be different from a point of view that when we say smoking causes lung cancer, there is no specific criteria that has been proven from the mobile usage point of view.
Okay.
But even in smoking, not every person who smokes will get lung cancer, but the correlation is significant.
Sure.
Right now, the only correlation we have is not directly with the use of the mobile per se at this point. Can it change in the future? Of course, we get more and more data and then it changes. All we have to do is be careful from our side. So I personally am of the opinion that ideally what is recommended for children probably is, I think, not more than 45 minutes per day, and that is screen time that involves television and everything.
Screen time.
I think
the
also same
includes I am watching a video on that.
Exactly, and the same I think should be applicable for the adults also.
But half of the time you are on WhatsApp.
Absolutely, and that is something that we for ourselves have to change. See, we always remember there was a time when parents used to tell us not to sit in front of the television or not to eat when we are
watching
TV,
television.
and not to do multitasking. And the same thing applies now as we are becoming parents.
But
to
now
apply.
parents are showing YouTube videos to their children so that they can eat.
And absolutely, you ask any pediatrician also, and they will say it has a significant effect on the overall, the growth. It may be functional growth, intellectual growth, social growth of a child. We are getting more and more psychological problems. I will not call them diseases, but people are more socially withdrawn. They don't know how to make friends. Initially when our mother used to cook in the kitchen, we used to hover around her all the time. Now, just so that the child sits quietly at a place, we just thrust our child in front of a mobile or any screen for that matter, and that is not correct.
That's not correct. Posture. I'm one of the victim. I already have a posture problem. So many people like me have a posture problem when it comes to because of usage of mobile or lifestyle problem.
And that is true. See, the way we are made, we are different from other animals in three aspects. One is we are animals who are always straight. We are perpendicular to the ground. Second is the use of speech. Our speech is more developed than any other mammal on the planet. And last is the use of thumb. These three things make us the most dominant species. But when God made us stand, what he did is he gave us certain caveats in our spine, which are not there in the spine of other animals. The first thing is the neck. Our neck is ideally supposed to be convexity forward. So when the convexity is forward, it means that my neutral angle, if I keep my eyes neutral without going up or down, if I keep my eyes neutral, the neck posture should approximately be 20-30 degrees towards the sky.
Okay.
But now any of us can just see how many times or what is the number of, what is the duration for which we actually look at the skies, like our ancestors used to do. Our entire day is either on the computers or on the books or on the tables or on the mobiles. Now, how can we change that? Again, it comes back to the same thing, that how much distance we keep. A TV is a larger screen away. So at least that part is something that we can, our neck is taken care of.
Okay.
But there are multiple ways of belling a cat, you can say. If you want to look at a mobile, I can take some support and look straight at the mobile rather than doing this. When I had started training for neurosurgery, the people we used to get in OPDs with spine problems used to be in their 40s. Now we are getting post-COVID, especially 20-year-olds who are having or struggling with neck issues just because of because everything has gone online. So automatically they struggle with these things. The same is applicable for our lower back also, because we are supposed to be animals who are more of walkers or sleepers. But now our modern lifestyle is we have become more of sitters.
Correct.
So the curvature of the lower back also is convexity forward. But even now when both of us are sitting, automatically to some extent it changes the natural curvature that has been given to us.
Okay.
And that causes long-term problems as we grow, as our age progresses. Is this going to worsen? Probably yes, because the use of how we are dependent on technology now is of course it's increasing basically as years are passing by. So we'll see how.
So you suggest that when I see mobile, I should be watching videos like this.
Correct. And same is applicable if you see the old libraries. Their desks were never like this.
Okay.
Their desks were also like this with some support on which you can keep a book.
Correct.
And that is probably something that we can go back to.
And with this kind of usage of phone, do you even have a twist or whatever it is for the
more
back?
than a twist? It is in whichever areas we keep our body. The body tries to cushion it with something.
Okay.
So our bones have some spikes at the back, which is a natural. We call it a spinous process. Now, when we are keeping it extended, that spinous process should not keep jetting out.
Okay.
So sometimes these people get a mound of fat there, and that is something which can be changed just by change in the posture. Now, other things that as such also should be done for bone health or natural posture is exercises.
Okay.
Walking is one of the things, because we are meant to be walkers. Walking automatically for the sake of walking and not gossiping and chit-chatting and looking here and there
Brisk walking
has a lot of good effects not only on the brain because of circulation, on the heart, on the spine, and overall, oxygen provision in the body, and that goes a long way.
So do walk.
Certainly.
But don't sit for a long time.
Yes.
How long can we sit for one phase?
Routinely now the companies also, all these MNCs and all, they are to some extent have started issuing guidelines about when a person sits for about 40 minutes or 45 minutes on a computer, for the next 5 minutes he should take a break. And on the screen, automatically the screen goes blank, and I've seen this in Japan, I think. And what exercises you should be doing, stretching and twisting and for the neck. You should do the same for the next 5 minutes, and then you carry on with your work.
So do exercise after, at least stretch.
Absolutely.
This posture correction, is natural posture correction is preferred, or we have these days posture correction belts that we people put?
Anything natural is always preferred by any of us. The very fact that we have these systems of medicine also, which are which should run parallel to our thing, something like Ayurveda and all. They tell us that nature provides us with a lot of opportunities. So of course, exercises, stretching, yoga, sagya goshti. I mean, these things go a long way in helping us in the.
So first, start your correcting your posture.
Absolutely.
When we speak of neurology, it's not just about brain, or it is just about brain.
No, neurology will include everything that is related to brain and the branches of the brain. The brain condenses to form the spinal cord, and there are 25 bones in the spine. And pratyek don bones, in between these two bones, 2 nerves come out on each side. These nerves travel all the way to whatever 600 plus muscles that we have. And this entire thing, right from the brain till the nerve reaches its muscle. Like when we talk of circulatory system, that includes the heart and all the blood vessels which take the blood away from the heart and to the heart. Same way, there are some nerves which take the sensations that we feel. When I touch a cold object or a hot object, I withdraw my hand. The sensations and my response to that, everything is under neurology.
So do you suggest that we should eat? Okay, one more thing which before I forget, keeping phone near your pillow when you sleep in the night. It's not advisable.
It's not advisable for the only reason that it will keep bleeping for some reason and you will wake up in the night.
That's the only reason.
That's the only reason.
No radiation.
If we are not using it generally, that doesn't cause. At least the data does not suggest that in the long.
So the dormant phone which is not used doesn't emit any.
But what happens is when we are in an area where there is no range or no network, and the phone has to work extra hard to get that time the radiation is high. When we are charging the phone, that time as such the heat that is produced, heat as such is detrimental for our body. Our body contains a lot of proteins. Imagine our brain also has 50% proteins. So anything that is very high energy yielding should be avoided. I am not a very big fan of phone anyhow. So if I were not a doctor, because now we have become dependent on the phones for multiple things. Plus my branch is such that we have to deal with a lot of emergencies. So as an occupational hazard, I have to keep my phone not on silent and close to me. But otherwise, I wouldn't have done that.
You would have kept it away.
Yeah, what we use as this word, the digital detoxification, is absolutely essential.
That's
because it changes our brain not only structurally. We have to think of the profound functional changes also. We just discussed those. How initially we used to read. It was very easy to read a book, a 100-page book. Now you take 100 children in a room and ask them to read 100 pages and tell what you have understood. They won't be able to tell us, many of them. Because our attention span has started reducing. And that is going to cause problems for smaller things that, for even while driving, whether we are giving attention to what is happening or even walking. So all these things do matter.
This reduction in attention span is largely because of our habit of using the phone, digital intrusion in our life,
and social media, 100%.
and social media.
Because now we have smaller and smaller reels, 20-second reel, 30-second reel, and you have to understand this. A brain is actually like a big tree. It looks like a tree. There is a brain stem. We actually call the small brain as brain stem. So imagine a tree with its stem and the flurry of the branches and leaves. Now anything that has to grow this big, it takes time. So it needs a habit which is consistent. Attention, focusing on the details, perseverance. Now what is happening is anything that is 30 minutes. So what grows in 3 days? Grass or weed.
Correct.
And it is of no use. So if you want your brain, every time you use a brain and repeat that habit again and again, it forms all these connections and then the brain flourishes. Otherwise, eventually we will be like people who will be entirely dependent on phone and not have a thought on our own. It's an inside joke that we have. We are worried about artificial intelligence, but we are not talking about natural stupidity. So that is also on the rise. So initially it was so easy to calculate things. Mathematics, certain things we used to just calculate on our fingers or in our mind, and now we just rely on the calculators and stuff.
Besides these trauma cases, what kind of cases which are related to neurology or neurosurgery that comes to you?
Mostly in Goa, as such. Also, I when we were having our discussion, that for the population that we have in Goa, our accident rate is one of the highest amongst the countries. And also the number of vehicles we have per family in Goa, as per I think whatever I had read in 2023, 5.6 vehicles
absolutely
per family. It is a huge number, total number of vehicles. Of course the trauma cases we get, and for very silly things, construction is going on, or there is wet slippery roads. It's a simple thing like wearing a seat belt and wearing a helmet. So I have seen so many young people, माझे केस खराब होतील, or I will sweat and I am going here and I don't want to. The parents keep telling me, generally he wears a helmet, but he was just going here. So you might be the safest driver in the country, but the person who hits you
may not be the
plus
safe.
In Goa, we have people who come from outside as tourists. We don't know who is under influence. So that drinking and driving, on top of that now with the mobile, as we discussed, texting and driving.
While driving.
So many problems we are anyways facing.
Are you getting such kind of patients?
We do, and it is horrible to treat. A young person coming with a head injury, even if we try to salvage him, the brain is such an organ, it keeps learning again and again. But certain areas of the brain are very, very eloquent, as we call them. That is, they are functionally so advanced that any damage to them, it becomes very difficult to gain back that at this age. So it sometimes breaks our heart also, to be honest.
Just one, because I am a movie buff, I want to ask you this question. Since the time we have been watching movies, we have seen ki kahin pe he had a hit and then he lost the memory. Again he had a hit, he got the memory. Is that true?
No, I wish it would be. It would have made our work so easy. Imagine, just get a patient and start hitting him. But there are so many things. There are memes now which we get on social media about not only brain. There are these videos about that heart falling in the patient and all. Movies show anything. It is just for fun. I think we have to take it as a pinch of salt.
There is.
And not even pinch, maybe lots of salt. But it generally doesn't work that way.
Another thing is that when you conduct a surgery on someone, especially when it comes to your brain, is it very painful, because you open the skull and you...
No, in fact, the great part about the brain is the brain itself, if you keep it on a table and you smash it, it will not complain. The brain doesn't as such feel pain.
Okay.
Most of the time, the headaches that we get, there is a very sensitive membrane over the brain, just under the bone. That membrane is very sensitive. So when people have brain tumor, let's say, and the tumor is increasing, once it starts pushing on that membrane because of increased pressure, that is when people get headache. That's why most of the time, people who have brain tumors or a bleed in the brain or a stroke will not get a severe headache also. So that is one thing, and because of that, now these are the things we have started using for our own benefit. So the latest things that we have managed to do here also is awake surgeries, where there are tumors which are placed in certain areas of the brain. So while removing them, these people are at higher risk of losing that part. So we keep them awake. What we do is we numb the skin. जसा आपण when we give blocks, while cesarean or while limb surgeries, we give a block all around the skull. And then we mark where the tumor is. We make a cut. We remove part of the bone.
The person is awake.
And the patient is awake. So
we
keep talking to him. We ask him to talk to us or move the limb that we want to check.
आज इस चाय के स्वाद में कुछ खास बात है।
देखते हैं खाना कैसे बनाती है।
भाभी, मेरे लिए सब्जी रोटी।
भाभी, मेरे लिए स्पेशल बासमती राइस।
डॉक्टर साहिबा, सबकी पसंद का ख्याल कैसे रखोगी? मेरी भी कुछ डिमांड है।
एक डॉक्टर होने के नाते सेहत का ख्याल रखना मेरा फर्ज है, और एक बहू होने के नाते परिवार वालों का दिल जीतना भी मेरा फर्ज है।
ये सब पॉसिबल हो पाया है पंचामृता की वजह से।
इंडिया का फर्स्ट फोर्टिफाइड राइस और इनके सारे प्रोडक्ट जो खाने में पौष्टिक तत्व की कमी को भर देते हैं। I certified where food is fortified.
We saw one video wherein we saw someone was watching some movie or something.
Exactly, that is what happens.
When the surgery was being performed.
But what we want is for them to not lose the function. So we have to keep interacting with them.
Okay.
See, some surgeries are different. They are done for functional things. म्हणजे लोकांना fit येते, seizure surgeries. Or when people have Parkinson's, then we put electrodes, like we put pacemaker for the heart. We put pacemaker in the kind of those similar kind of wires in the brain. And for certain Parkinson's patient, it helps them. But the surgeries that I am talking about is, I want to see whilst I am removing the tumor, the patient doesn't stop moving the hand.
Okay.
So I want him to do certain specific activities. So if I am operating on the left side of the brain controls speech, understanding as well as talking, especially in people who are right-handed. So when I am operating in a certain area, I want the patient to keep telling me about certain, anything. I mean, about his life or what he likes and all.
They should keep on speaking.
Yes. But then there are multiple restrictions, but now we have those kind of advances which are happening.
So this is also part of your surgery procedure.
Absolutely. Now we are getting so many. We can when we are operating on certain tumors, we can monitor those nerves on the table when the patient is under anesthesia. We can directly stimulate the nerve and see twitching of the muscle to ensure that when I am removing the tumor, the nerve, like in the leg, if there is a tumor on the nerve, I can remove the tumor without touching or damaging the nerve. Or during surgery, we can check how much tumor we have removed by using ultrasound probably. There are now endoscopes. There are other markers that we are getting. So like most of the branches around us, you take any surgical branch, forget surgical branch, you take any branch in society. Over the past 20 years, with the advent of internet and this, multiple advances have happened. So we use a lot.
It is beneficial for the patients.
It is.
Doctor, memory, as far as memory is concerned, it is also a part of your stream, neurology?
It is. I mean, I don't directly deal with the problems of memory when it comes to, because it is any part of the body or any part of anything will have two problems, two components. One is a structural component and one is a functional component. For example, we can see the wiring. Now, if the wiring is cut, then it is my job to fix the wire. That is a structural part. And if the wire is okay, but there is no current flowing in that.
Okay.
So it looks normal. So that can only be changed with medicines, or we can attempt to change it with medicines. That generally comes under the purview of neurology.
Okay.
So memory loss, can it be because of a tumor or a bleed or an accident? Answer is yes, because some part of the brain is damaged. But when we talk of dementia or when we talk of Alzheimer's, all these things are functional. So now multiple advances are happening on that front. Newer medicines are coming. When it comes to brain, my advice is same. For the brain, at least, prevention is always better than cure. So
Multitasking. People have got a habit of multitasking, and traditionally in our families, women usually multitask.
Correct.
एक तरफ से they have clothes to wash, at the same time they are cooking, same time they are attending to someone at home. So it's good or it's bad for brains?
For the brain overall, it is good, but not when you are doing certain activities. See, when you are driving, you are already multitasking. Your hands are on something, your leg you are managing separately, you are looking for other vehicles which are coming. But concentration and multitasking are two different things, is what I feel. When our mothers used to do all these things, or even when our family we used to do multitasking, none of them were at a direct risk to life. In that also, sometimes we used to see, "Are दूध उती गेलं किंवा काहीतरी करपलं." So these things used to happen. Even now they happen. But there is no direct risk to life in all these things. If it is there and if a person is unable, he should stop. When we say the same thing, there are some people who will learn better when they listen to some music. Now the brain is wired that way. But later on what will happen, that every time he wants to remember something, he will need the music.
Okay. To recall.
We see those videos of cricketers, Virendra Sehwag singing some song while trying to hit a six. But it becomes a muscle memory. Even some surgeons would want a little bit of music playing in the theatre, not rock music, but little instrumental or something, because it might help them enhance the skill. But that I wouldn't call as multitasking per se, because they will be primarily focused on what they are doing. So all these things.
Does listening to music helps you?
It certainly helps. In fact, it is one of the good things. If you ask 10 things that you should do to protect your brain, music is always included in that. But somehow they say that when we are listening to music, we are using most of our brain, unlike anything else. Reading is one such good habit. Mindfulness is the word, but the easiest way is to focus on the breathing. So our body needs oxygen. We generally don't even take a normal deep breath once in our day. And not utilizing our lungs or our body that we have been given. So all these small things do go a long way.
Okay, this is a very childish question for a podcast like this.
No question is childish, please.
लोग बोलते हैं कि you should दिमाग का इस्तेमाल करो, नहीं तो क्या फायदा? It's those things which you don't use eventually are rendered useless.
100%.
Is it true that if I don't use my brain, I leave everything for AI, everything for technology?
It is so true. Even the AI has come because of our intelligence, and the brain is primarily made for that. See, as a surgeon, if I don't operate on any patient for 6 months or 1 year, I will slowly start losing that dexterity of the hand or whatever approach I have. Same applies to the brain. See, we have to take care of it like any other organ that we say. Liver ahe. Liver detoxifies certain things for our body. How do we take care of it? Not drink alcohol. How do we purify the liver? Eat some things, because it is part of the GI system. When we talk of lungs, how do we say purify the lungs? Don't smoke. Try to deep breathe and all those things. How do we take care of the heart? Regular exercise. Now the function of the brain is thinking. Function of the brain is to help move this, talk well, understand things. So we should of course do things which help the brain.
But
so solving crosswords, reading, playing sports because of oxygenation and all. Following certain steady habits will of course go a long way in building up the the power of the brain, as you can say.
Overthinking spoils your brain?
Generally it doesn't, but it spoils the mind. So I think my better half will be able to answer that question. She's a psychiatrist basically. But see, anything overeating, oversleeping is bad. Similarly, overthinking is also bad.
Okay, we have noticed one thing about neurology and people who are elderly in the sense who have crossed 70, 80 years of age. Sometimes we see that they are actually doing well, but suddenly they have some kind of problem in as far as neurology is concerned, then they have to be taken to the hospital.
No, some of these problems can be neurological. Some of these problems are neurosurgical. Now, amongst the problems which are neurological, as the age progresses, overall the functioning of all the organs goes down. Now, let's say already a patient is on a threshold of going down, and he gets some infection, or as simple as the sodium in his body goes down. Sodium is also very essential for the working of the brain. So sometimes these people go in what we call as a delirium, where they don't know where they are. But it depends on a lot of factors. So we have to investigate those factors. Once we rule them out, then we have to see whether it is a problem of the functioning of the body or functioning of the mind.
Okay.
But neurosurgically, especially after starting practice in Goa, what I've realized is neurosurgically also there are these problems. Now, as such also in Goa, people live beyond 80, 85, 90 and they are very fit. So they are more ambulant. On top of that, they have some heart problems. So now the percentage of people who are on blood thinners is increasing. So in all these people, what happens is sometimes just because of a trivial injury, they bang the door or they simply when they're trying to sleep, they hit the edge of the bed. Immediately nothing happens. But in about 10% of these people, slowly a collection forms between the skull and the brain. And over a period of 8 to 10 weeks, it goes to a point slowly where it starts pressing on the brain. And then their function suddenly starts going down in a period of 4 to 5 days. This entity is called chronic subdural. Chronic subdural hematoma, basically chronic as in it has happened over a month. Subdural as it is below the bone but above the brain. Hematoma is a clot. This is becoming slightly more common now with all these things. And the treatment is actually we have to drain it. Now, one of the concerns when people come to us with this problem is the age, because this is not a problem that will happen in a 60-year-old. It is a problem which will happen generally above the age of 65 or 70. So at this age, is it safe to operate, and all these questions come. The good part is we are not directly touching the brain. And once we drain it, the patient goes back to his complete function because the pressure on the brain is completely released. So in that way, these are few things that we have to be careful when we are dealing with the elderly, especially now in the context of...
For those people who don't know, doctor has performed surgery on 95-year-old, if I'm not wrong, patient.
Yes. And that was a chronic subdural.
95-year-old.
Yes. There was one who was 98 also.
Okay.
But that time I think probably...
Is that a history, something sort of record?
Probably I said. But 95, the importance of that is for people to know certain things. One is currently if you are living longer, then of course multiple problems are going to come. So even medicine is now getting ready to deal with these problems. Second thing, you have to, at no age, I have seen 60-year-olds who look like or behave like 95-year-olds and 95-year-olds who behave like 60-year-olds. So it all depends on, brain is a learning organ, unlike anything else. So it all depends. We don't decide as a bulk that if this comes, we'll keep operating.
Okay.
See, there are certain people who are less than 60, we have decided that we should not do anything. Because finally, whenever I am wanting to operate, I should also benefit the patient. See, can I operate on all tumors? Answer is of course yes. Should I operate? Or more important is, when should I not operate? Is also part of our training. And when we make a decision for the patient, it has to go through that. So if I know he has a problem which I can take care of without causing much damage. See, risk is always there. I cross this road now at Miramar. There is a 5% chance some vehicle will hit me.
Absolutely. Yeah.
But I will still do that. So the risk to life after operating on these tumors is much less as compared to
with tumors.
Enough said! Bringing in the rhythm, what you're feeling is the vibe. hard to make a dream and wanna race it to the tribe. Enough said, it's in, so I joined the tribe. Enough said. No one ever see me cause I'm racing against the time. Wanna hear you scream. This my ride.
Okay, last, everyone would like to know any specific diet that you would like to prescribe for a better brain or healthier brain?
See, the brain as such is around 40% proteins, 40% fats, and then glucose and all those things. We generally say that fats are not good, but not all fats are the same. Right from the start of our discussion, I have been telling anything that is excess is going to be a problem. When we say that you avoid salt, people think alnis jeevan daisa, put nothing in that. No, that is not. You need salt for functioning of the body. That is why it is there. That is why oceans are made which has so much salt. You know? But how much to have? That is the question. So, should you eat or should you consume fats? Answer is yes. But that fat should be enough to cook the meal. If I like some chips, I shouldn't be finishing the packet of chips. 2 chips every day for taste is fine. So that is something that people don't. Moderation चा जो concept असतो जो आधी होता, currently it is not there. We want something, we want the topmost thing.
Correct. Absolutely.
But the function of the car is to take me from one place to another. But people would want the high end cars. The same happens when we are discussing food also. The diet we should be following. Best proteins are of course what we as Goans consume. Fish.
Okay.
Boiled, presumably large fish. Eggs is good. White meat, chicken is good. Green leafy vegetables and milk based products, if you can tolerate them, are considered good. One of the concepts that I had heard in general about any health is ज्या प्रोडक्टची एक्सपायरी डेट जितकी दूर असेल, the longer the expiry date, the worse that food is for you.
The worst, huh? Okay.
So if it has a higher shelf life, any product which can last for 2 years, of course, has a lot of preservatives.
Correct.
It has a lot of salt. It has a lot of chemicals. The food which we cook at that point of time, and if we don't eat for 6 hours, 12 hours, it will go bad. It's the best for us.
Correct.
So that is how.
That's the organic things you have to.
That's why we say green leafy vegetables. Why are they good? Because they get spoiled.
Okay.
Same happens with fruits. If they are going to go waste in a span of 4 to 5 days, then of course we should have. The other things which are absolutely fantastic are dry fruits, because they contain a lot of excellent fatty acids and chemicals which are very good for our brain. Walnuts also, almonds also, groundnuts also. But again, if you just keep eating this, are you going to be smart? Answer is no. You have to practice. Even if you are Sachin Tendulkar, you have to be on the ground from the age of 4 for 12-14 years to make this many, 12-14 hours to make this many runs. So that practice of the brain, you have to keep using your brain as much as possible.
Use the brain.
And see, the brain doesn't understand the difference between fun and work.
Okay.
This is our concepts. These are concepts of the mind. Brain is made to work. So when you are reading, आपण हे जे म्हणतो की unwind व्हायला पाहिजे वगैरे, technically brain doesn't understand that. It is the rest of the stress. It is not finishing the project. It is a deadline to finish the project as per your boss wants. That stress is what makes us use the word that if I'm not doing that, then I will unwind.
Okay.
But watching television and these serials and all consistently, binge
watching
is not taking care of your brain.
Not
your
right.
brain has to work. That's why reading is an active process. So anything active you do is good for the brain. Anything passive is kind of not so.
Thank you, doctor. Thank you very much. But before we wind up, a very again foolish question: a dumb person's brain and intelligent person's brain look same?
This word that we use, dumb, actually we don't use. It all depends on. Everyone is smart in their own ways.
Okay.
When we are now discussing this I think on a psychological basis, we get these words called autism and see, their brain is wired in such a way that they might be good at something that we don't know.
Something else that
आपला
we-
societyचा criteria for calling a person intelligent and dumb. Right now, if you are asking me so many questions about neurology, neurosurgery, and I am answering them, you ask me one question about how to fix a car, I'll be completely dumbfounded. Forget that. You ask me something about, you were discussing about Dr. Rohan or Dr. Jyoti. You
Yes.
ask me how a knee works. I won't be able to answer but that doesn't make me dumb. So, of course, how to find, and there are causes because of which the brain of a person may not work as these concepts of IQ and all. But even those concepts now are based on certain things. See, when they do an IQ test, they will always tell you that it is based on this. So it should not be taken as a bottom line.
So person with a higher IQ and lower IQ, that lower IQ person may also be intelligent in some other sense.
Probably. But the intelligence आपण ज्याला म्हणतो,
Intelligence quotient that they
पण आता ते आपण कसं मेजर करणार यावर पण खूप डिपेंड करतं. Now for a person who has some congenital issues, the rest, like the way the heart doesn't work, your children need heart surgery and all. Of course, we are not reached a stage where we can correct this congenital brain problems.
Okay.
There might be in the future be a time 10 years down the line, 20 years down the line, where genetically only we may try to modify or find out what is going to happen and then rectify those things. We probably will reach. 20 years ago, we didn't know we will reach here when we will be operating on patients with all this newer
awake and
microscope and all these
responding.
things. But now it is happening. Now we are going, even for surgery, we have certain specific areas where if there is a small tumor which is left behind, rather than radiating the whole brain, we can radiate only that small part. So we can pinpoint the location of that tumor without touching the rest of the brain. We didn't have that, but things might change.
Now it's
Certainly.
more specific to that tumor rather than complete brain. Thank you very much, doctor.
it was a
Thank
pleasure.
you very much. In
Thank
fact, कोंकणीन सांगचे म्हटल्यार ज्यो गजाली डॉक्टरान सांगल्या त्यो आमी एक्चुअली मिस्टेक्स रेगुलरली करता, रायट, वेन इट कम्स टू सोशल मिडिया, वेन इट कम्स टू हँडलिंग मोबायल. In fact, the way you handle mobile, the way you sit, your postures, everything, that we commit mistake every day. So after this podcast, we hope at least some people will change their habits, and we will see more people with less hunches.
No,
better
and the
backbone.
other thing is, we have mobile in our hands. We use it for checking so many things, but we don't use it for our own health. We are so ignorant about, we'll know about what is happening on the other side of the planet, other side of the universe. But if you ask how the eye works, so only thing we have to say is what are the good sitting techniques.
Okay.
And our this Siri
Good
or
exercises, good
Gemini
sitting
will give us so many things,
Okay. Use
so
the technology
use the technology for your own
to
benefit.
counter the defects that is created
See,
by
we are already living long. We should also live healthy. That is more important.
Thank you, doctor.
Yeah.
तुम्ही पळयतात हब पॉडकास्ट. दिस प्रोग्राम इज ब्रॉट टू यू in association with Manipal Hospitals. You are watching this podcast on your favorite channel Goa News Up. Keep watching us, but before that, if you have been watching us till this minute or second, that means you have liked this program. So kindly, before going, subscribe to this channel so that we can see more such videos. Keep watching us.